Hi, I'm Dr. Amber Khan, and I'm the Director of Education US for Heart, Women, and Girls. One of the most common questions we get asked is, do we teach using the anatomically correct terms for private body parts? Silly and cute nicknames for private body parts is a common tradition among many households. People of all different cultural, religious, and socioeconomic backgrounds will use a name other than the medical term in conversation, whether it's between a parent and a child or even among peers. It allows for a personal code between family to talk about private parts with dignity, courtesy, and respect. It's natural and it's normal to feel a sense of shyness when we hear or say the word out loud. However, it becomes unnatural if the real names are 1. Never taught, 2. Reluctantly used even if one has a medical concern, 3. Gives one a sense of shame or fear when used by a survivor of sexual violence, and 4. Met with disapproval by an authority figure that can lead to a breakdown in the lines of communication. Learning the anatomically correct terms for private body parts is essential for proper reproductive and sexual health education. But there is a strong discomfort felt by many to teach these words even within an educational atmosphere. So why is there a discomfort in saying the correct terms? One belief is that such language shouldn't be used so casually. Part of learning the medical terms to private body parts is knowing how and when to use them. It's not meant to take away the nicknames. Another belief is that learning the names of body parts will encourage sexual activity. There's this belief among parents that they can maintain a child's innocence by keeping them ignorant. But there's a difference between innocence and ignorance. Ignorance is dangerous. So what happens when you only teach with a nickname? Number one is confusion over the real name. A sex educator in Toronto had recounted a heartbreaking story told at her workshop by a woman who was sexually abused as a child. Back then, the only word she knew for a private part was cookie. So when she told her teacher that someone wanted her cookie, the teacher told her she had to share. It's obvious that the consequence of this was that the abuse had continued. She did not have the tools she needed to properly disclose what was happening to her. Number two is shame. To avoid the real term can make one think that those body parts are shameful and therefore they should never be talked about, even if one has a medical concern or in a situation of abuse. The American Academy of Pediatrics states that parents should teach their children the real names of body parts, and that to just use the made-up names can give the idea that there is something bad about the proper name. And third, this can shut down lines of communication between a child and an adult. Leaving a child alone to deal with real issues of sexuality and health can lead to engaging in risky behavior, it can reinforce the culture of secrets, and it can encourage a silence that sexual predators rely on for cover. So what happens when you teach reproductive and sexual health education using the real terms for body parts? One is ownership. It gives you a sense of empowerment when you know your body. This can begin as early as the age of 2. By 2, most children can decipher the physical difference between girls and boys. This is a great time to teach your kids about what their body parts are, which of those are private, and the difference between good and bad touch. Number two is that it creates boundaries. In casual settings, the nicknames are more fitting and appropriate. However, in all other settings, hearing and saying the real terms should not just be preferred, but expected. A 1995 study found that sex offenders would avoid children who knew the real names of private body parts because it suggests that they were given education on sexuality and safety. And finally, is confidence, to talk explicitly to professionals about one's medical concerns or abuse. A 2003 study had asked children ages 3 through 10 to name the private body part in 8 medically based scenarios. Out of those 8 questions, the mean for them using a correct anatomical term was only 1.2. The researchers had stated that Effective communication between a clinician and a patient is essential for adequate medical history, and it is especially important when talking to children and caretakers in regards to situations with medical legal implications. An example of that is sexual abuse. Relevant research shows that children who are comfortable talking about their bodies with the correct terminology are more likely to disclose when something worrisome or uncomfortable is happening to them. Nicknames can be a silly yet respectful way of openly discussing private body parts. But when the situation is not silly but serious, the real term needs to be used. Educationally, medically, and in some cases even legally, one has to hear or say the real word, because that's all it is. It's a word for a part that no matter how you choose to say it, will always be private. Please check out the description box below for more information on Heart Women and Girls. Thanks for watching.